basic way. Okay. So what are the types of data? So an overview of the type of data would be, data is qualitative and quantitative. So what do you understand by qualitative? As written here, a data which is non-numerical and simply descriptive is called qualitative. On the other hand, quantitative is something that you can measure, something that you can count, that is quantitative. So a qualitative data is of two types, nominal and ordinal. Please listen to this carefully. These are basis of your professional exam questions and your MCQs. And this will be important throughout your lifetime if you are going to persist on research. So qualitative data would be of two types, nominal and ordinal. Nominal data have no order. They have no order. So going by the example, blood groups. Blood group A, B, O, and AB. Can you order them? Can you tell which blood group is better than whom? Which blood group ranks higher? Do you have any criteria defining that? Gender, male, female. The RNTCP TB category 1, 2, 3. Can you tell what are the does this have an order? This is better than that. This is not higher than that or lower than that. Can this be defined?
No, sir.
No, sir.
So that is nominal. As I said previously, nominal, I mean, in community medicine, everything goes by mostly your English nomenclature. So nominal means names, and names have no categories, no order, right? So blood group A, B, O are examples of nominal data. Next comes ordinal data. Ordinal data have categories with a natural order. So if someone you have seen a hospital patient, I mean admitted patient, they will have to mark when they're getting admitted what is their pain score, if it is mild, moderate, or severe, right? So that has a natural order. Moderate will always be higher than mild, and severe would always be higher than moderate. So they have a natural order. Hence, this is called ordinal data, and these can be arranged in order, right? Next comes the category of quantitative data, quantitative or numerical data. Quantitative data can be discrete or continuous. What is discrete? Which does not have integers, which does not have any value after decimal, right? So they can be counted in integers only. They are whole numbers. So the number of children immunized per week or the number of hospital admissions in a week, they cannot be defined in 3,070.75, right? They are individual discrete numbers. So if it is number of children, it cannot be 3.5. It has to be 3, right? So quantitative data can be divided into two groups of data. Discrete being those in whole numbers, and continuous being those which can accommodate any value. Hemoglobin levels can be 13.6, it can be 13.02, right? So this is your overview of the various types of data that we will deal with, and there will be no data apart from this that you have to deal with during your medical research. So the nominal data, categories with no intrinsic order. Ordinal data, categories with logical or natural orders. The examples being blood group ABO, gender male, female, cancer, and in case of ordinal data, cancer stages 1, 2, 3, pain severity, mild, moderate, severe. Okay. So these are your qualitative data types. Next come the quantitative data types. Data with measurable quantities. That is weight, hemoglobin level, blood sugar are the examples. These are infinite values in a range that can be in decimals, right? And discrete data, countable whole numbers only. The number of children, 3. The total number of admissions in June 2025, 1438. These won't be housing any decimal numbers. Okay. So, and secondary variation of data is primary data and secondary data. This is an MCQ question. So what is a primary data? Primary data is what you have collected firsthand. That as Akanksha had said, that We go to the hospital, we go to the admission desk, and find from the register, we find out that these are the patients. We go to the every individual patients, see their files and collect data, right? That is your primary data. And what is secondary data? You go to NFHS website and find out what is the prevalence of anemic adolescent women in West Bengal. That becomes your secondary data, which has been collected by someone else, and you are just reusing it for your own research, right? So the understanding of data is clear.